Just made a statement that's factually incorrect. No decision has been made yet on whether Lightburn would constitute major service change. You're factually incorrect. You should be accurate with the things you say in this chamber.
Cabinet Secretary Shona Robison.
Thank you, Presiding Officer. This provides a timely opportunity to acknowledge the commitment and dedication of health and social care staff across the whole of Scotland, to reflect on our record of protecting and enhancing local services, and to comment on the actions being taken to ensure that Scotland's NHS continues to be world class. I would also want to welcome local people to the gallery. Turning to the Labour motion, I think it would be helpful to state the facts as initially set out in response to Jackie Bailey's members' debate on the same issues on the 13th of September. Firstly, no final decisions have been made about the service change proposals mentioned. NHS Greater Glasgow and Clyde formalised their proposals at their board meeting in August and, as we would expect, are now in the process of engaging with the affected local community, staff and other stakeholders so they can carefully consider their views. And I would certainly encourage local people and their representatives to play a full part in that process, and note that the proposals may well change in the light of the results of that process. This will take the form of 3 months public engagement on the proposals relating to the Centre for Integrative Care, community maternity units and Lightburn Hospital, running from September until November. This will help to inform the Health Board's ongoing work with the Independent Scottish Health Council, which includes coming to a view on which of these service changes should be considered major. The Board will reconvene following this work, probably at their meeting planned for December, and will then agree the next steps. Should any of the final proposals be designated major, then the Board must undertake formal public consultation of at least 3 months, and their final service change proposals will be subject to ministerial approval. This is an established, robust process informed by the work of the Scottish Health Council. I want to know what they think when I come to make the decisions, and the Board wants to know what they think when it comes to making their decisions. It was set up by statute in 2005 to provide independent oversight in the key area of patient focus and public engagements by this Parliament. The Labour motion quite inappropriately asked Parliament to cut across the vital work of the Scottish Health Council. They should be allowed to get on with their job and fulfil the duties that this Parliament ascribed to them. What is the point of having the Scottish Health Council if we're not going to allow them to get on with their work? Returning to the service change proposals, in the case of the plans to... Yes, of course.
Mr McMillan.
Thanks very much. Thanks very much for taking intervention, Cabinet Secretary. But Cabinet Secretary, would you agree with me that in terms of the NHS Greater Glasgow and Clyde proposals for the IRH birthing unit, that with their consultation proposals thus far, they're not suggesting to have a public meeting? I've asked the Health Board to actually have a public meeting in Inverclyde so that these issues regarding the birthing unit could be fully addressed. But is that something that you would agree with?
The Health Board to have as much public engagement as is possible, including public meetings and other ways of engaging. I think that's important. But returning to the service change proposals, in the case of the plans to transfer paediatric inpatient and day cases from the Royal Alexandra Hospital in Paisley to the new Royal Hospital for Children, NHS Greater Glasgow and Clyde will discuss the next steps at their meeting in October. The Board has already been clear that should they move to proceed with these paediatric proposals, it would represent major service change and therefore would come to me for decision. In terms of the trauma orthopaedic services at Monklands Hospital, NHS Lanarkshire, as supported by the Academy of Royal Colleges and Faculties in Scotland, has been clear that the interim changes are necessary in order to ensure the safety, quality and resilience of local services. I have been assured that the interim plans will not materially impact on the provision of A&E services at any of the 3 main hospitals in Lanarkshire. The Health Board has also repeatedly given assurances that it is committed to retaining 3 district general hospitals with full A&E departments as part of their longer-term plans. Those longer-term plans will constitute major change and, as such, are now subject to formal public consultation, and those plans will come to me for decision. So I would encourage all local stakeholders to play a full part in the consultation in order to help shape the future of those local services. The Labour... Briefly.
Ms Smith.
thank you very much to the Cabinet Secretary for taking the intervention. Having just said what the Cabinet Secretary said about public consultation, I wonder if she can comment on the fact that orthopaedics and trauma, which I would consider a major service change, is being removed, having a decision having been taken during the recess with no public consultation.
Cabinet Secretary.
Explained that that is an interim solution based on patient safety, but the longer term plans are major service change which have to come to me. It's very clear and straightforward, and if any politician would stand in the face of being told that a service is not safe, then I think we all have to take some responsibility for the decisions and ignoring clinical advice. And the interim proposals, it is very clear it is based on patient safety advice, and we have to listen very seriously to that. The Labour motion also refers to cleft palate services at the Royal Hospital for Sick Children in Edinburgh. Ministers are fully aware of the strength of feeling from those who oppose the recommendation to consolidate cleft surgery in Glasgow. There are very strong views on both sides. I want to be clear that the Government has been given an assurance that the proposed changes relate only to cleft surgery. Nonetheless, these remain proposals and no decision has been made. As the Minister for Public Health and Sport made clear in the members' debate on this on the 7th of September, our decision will be informed by the planned visits that I am undertaking to both Edinburgh and Glasgow to visit the cleft surgery teams and to hear their views first. Presiding Officer, the possibility that some or all of these service change proposals may change as a result of the public engagement underway, and that some or indeed all may ultimately be subject to ministerial approval, means it would be inappropriate for me to discuss the specifics in any detail today and to say whether or not I support them. If I'm making the final decision on them, then of course I will wait for the information and the evidence to be brought to me. But I want to be clear that this Government remains committed to robust evidence-based policy making as set out in our national clinical
Mr.
strategy.
Sarwar, I'm not keen on props.
This is our long-term commitment to secure local services and develop specialised services when necessary. I am prepared to take difficult decisions where the evidence supports it. However, where change is advocated, we must ensure that local boards work with all stakeholders to make the case. What we will not countenance is change being dictated to local communities, as has happened in the past under your administration, Mr. Sarwar. I would reiterate that local people can be assured this Government will always focus our approach on providing as many services as locally as possible. And our record in Government stands in stark contrast to that of the previous administration, whether it was Nicola Sturgeon's coming to Parliament to save the A&E departments at Monklands and Ayr, or whether it was protecting the damaging uncertainty of the previous administration, the Labour-led administration that Jackie Baillie served in when the Vale of Leven Hospital was under serious threat of closure. The Vision for the Vale has saved that local hospital, and indeed we will make sure that those services that were lost under previous proposals that we make sure that services going forward are improved. And of course the local hospital has seen a big improvement and a big increase in the number of patients using those local facilities. Finally, Presiding Officer, I note that opposition parties constantly call for increased investment in primary and community care and say that they support shifting the balance of care. We had the Tories saying that only last week. At the same time, they come and they seek to oppose each and every proposed change, even where they're not proposed in acute services. We are going to have to collectively come to some decisions about whether politicians in this place are going to argue against any change, anywhere, ever happening in our NHS now or into the future. Because if that is the case, then the shift in the balance of care and the increased investment in primary care called for by the Tories only last week will be made all the more difficult to achieve. I want to, in closing, reiterate this Government's commitment to the delivery of high-quality, sustainable health and social care services. Where there are proposals for major service change in the NHS, they must be subject to formal public consultation and ultimately ministerial approval. And I don't shirk my responsibility whatsoever in doing that. local people can be assured that in all such cases, ministers take all the available information and representations into account before coming to a final decision. I think that is a proper and responsible way, Presiding Officer, to run our health service, and I move the amendment in my name.
Thank you.